Hello, I am student nurse Diana, and today we are going to finish chapter 10 in anatomy, the nervous system. Okay, I'm on page 190. Fast fact. Most cranial nerves transmit impulses to receptors on the same side of the body. Consequently, a lesion on one side of the brainstem will produce sensory or motor symptoms on the same side of the body. Exceptions are the optic and trochlear nerves. Fast fact, brain swelling from an injury or tumor can cause pressure on the oculomotor nerve. This will interfere with the ability of the pupils to respond to light, which is why a patient's pupils are checked following a head injury. Life lesson: cranial nerve disorders. Inflammation of the trigeminal nerve can cause trigeminal neuralgia or tic douloureux. In this disorder, such things as eating, drinking, toothbrushing, shaving, or even changes in temperature can trigger brief episodes of intense pain. Although the pain lasts only a few seconds, it strikes frequently at unpredictable times. Severe cases may require surgery to sever the trigeminal nerve. This stops the attacks of pain, but it also leads to numbness of the face, scalp, teeth, and conjunctiva on the afflicted side. In Bell's palsy, dysfunction of the facial nerve causes paralysis of the facial muscles on one side. Consequently, the muscles on one side of the face sag, the eyelid droops, and that side of the face shows no expression. The cause of Bell's palsy is often unclear, although infection by a virus is suspected. Other possible causes include Lyme disease or a middle ear infection. The condition usually resolves in 3 to 5 weeks. The autonomic nervous system. The autonomic nervous system, ANS, is a subdivision of the nervous system responsible for regulating the activities that maintain homeostasis. These activities include such things as the secretion of digestive enzymes, the constriction and dilation of blood vessels for the maintenance of blood pressure, and the secretion of hormones. Most of these activities occur without your awareness or control. In other words, they happen independently or autonomously, which is how the ANS received its name. The ANS sends motor impulses to cardiac muscle, glands, and smooth muscle, as opposed to skeletal muscle, which is innervated by the peripheral nervous system. Because the ANS targets organs, it's sometimes called the visceral motor system. The ANS asserts control through visceral reflexes, similar to somatic reflexes discussed earlier, but instead of affecting a skeletal muscle, these reflexes affect an organ. While the following illustration shows the visceral reflex arc responsible for the regulation of blood pressure, all visceral reflexes follow similar steps. This is page 191 in the book. I'm going to show the animation.
Autonomic nervous system, ANS, is responsible for regulating the activities that maintain the steady state of homeostasis. The ANS asserts control through visceral reflexes. All visceral reflexes follow similar steps. To illustrate the process, let's look at the visceral reflex arc responsible for the regulation of blood pressure. The process begins when receptors detect a change in body conditions. In this instance, pressure receptors in the carotid artery, called baroreceptors, detect a change in blood pressure. Afferent neurons transmit information about this change to the central nervous system. The glossopharyngeal nerve relays this information to the medulla oblongata. The brain processes this information and transmits a signal along an efferent nerve. Here, the vagus nerve sends a signal to the heart's pacemaker to slow its rate. The effector organ receives the message and responds. The heart rate slows, and the blood pressure drops.
Page 192. Autonomic motor pathways, both sympathetic and parasympathetic, differ from the somatic motor pathways discussed earlier. As previously learned, somatic pathways are structured as follows. The neuron's cell body lies within the CNS, either the brain or spinal cord. A single myelinated axon extends from the brainstem or spinal cord to a skeletal muscle. At the target muscle, the neurotransmitter acetylcholine, ACH, is released to cause muscle contraction. In contrast, autonomic pathways employ two neurons to reach a target organ. A myelinated preganglionic neuron extends from the brainstem or spinal cord to a ganglion. In the ganglion, it synapses with a postganglionic neuron. Here, the neurotransmitter ACH is released. The axon of the unmyelinated postganglionic neuron extends to the target organ. Here, the neurotransmitter released varies. Parasympathetic fibers release ACH, or acetylcholine, or while sympathetic fibers release norepinephrine, NE. Comparison of somatic and autonomic nervous systems. Somatic innervates skeletal muscle, consists of one nerve fiber leading from the CNS to the target with no ganglia. It secretes neurotransmitter acetylcholine. It has an excitatory effect on target cells, and it operates under voluntary control. The autonomic nervous system innervates glands, smooth muscle, and cardiac muscle. Consists of two nerve fibers that synapse at a ganglion before reaching target. Secretes both acetylcholine and norepinephrine as neurotransmitters. May excite or inhibit target cells. Operates involuntarily. Divisions of the autonomic nervous system. The ANS consists of two divisions, the sympathetic division and the parasympathetic division. These two divisions have separate neural pathways and perform different functions. However, they often both innervate the same organ. The sympathetic division prepares the body for physical activity. It's also the system that's called into play during times of extreme stress, anger, or fear. Because this division prepares someone to fight or flee from danger, its effects are called the fight or flight reaction. In contrast, the parasympathetic division has a calming effect on body functions. The following chart contrasts some of the effects of these two systems. The sympathetic division. I'm going to just play this animation here.
Division of the autonomic nervous system prepares the body for physical activity. It is also responsible for the fight or flight reaction that occurs during times of extreme stress. The sympathetic division is also called the thoracolumbar division because it arises from the thoracic and lumbar regions of the spinal cord. From the cell bodies in the spinal cord, myelinated fibers reach to sympathetic ganglia, most of which exist in chains along both sides of the spinal cord. Because the ganglia lie close to the spinal cord, the preganglionic neurons are short. Not all preganglionic neurons synapse in the first ganglion they encounter. Some travel up or down the chain to synapse with other ganglia at different levels. Others pass through the first ganglion to synapse with another ganglion a short distance away. Unmyelinated postganglionic fibers leave the ganglia and extend to the target organs. Postganglionic fibers tend to be long. Each preganglionic neuron of the sympathetic division branches and synapses with multiple postganglionic neurons. This arrangement allows one preganglionic neuron to excite multiple postganglionic neurons simultaneously. That is why the sympathetic division can ignite such an immediate, widespread response.
The following chart contrasts some of the effects of these two systems. The sympathetic division increases alertness, increases heart rate, dilates bronchial tubes to increase airflow in the lungs, dilates blood vessels of skeletal muscles to increase blood flow, inhibits intestinal motility, so it slows down your digestion. It stimulates secretion of thick salivary mucus. It stimulates sweat glands. It stimulates adrenal medulla to secrete epinephrine. It has no effect on the urinary bladder or internal sphincter. Causes fight or flight response. Whereas the parasympathetic division has a calming effect. It decreases the heart rate. It constricts bronchial tubes to decrease airflow in lungs. It has no effect on blood vessels of skeletal muscles. It stimulates intestinal motility and secretion to promote digestion. It stimulates secretion of thin salivary mucus. It has no effect on sweat glands, and it has no effect on adrenal medulla. It stimulates the bladder wall to contract and internal sphincter to relax to cause urination. Causes the resting and digesting state. That's the parasympathetic division of the autonomic nervous system. That makes sense. To remember the effects of the sympathetic division of the ANS, think about a time when you were really angry or scared. How did you feel? Most likely, your heart pounded. You took deep, rapid breaths. Your palms sweated. Your pupils dilated. Your mouth felt dry. These symptoms illustrate the fight or flight response of the sympathetic division, all of which are designed to promote energy use by the skeletal muscles. The body at work. Both the sympathetic and parasympathetic divisions of the ANS work at the same time, providing a background level of activity called autonomic tone. The balance between sympathetic and parasympathetic activity constantly changes depending on the body's needs. During times of activity or stress, the sympathetic division dominates. At rest, parasympathetic activity takes center stage. However, neither the sympathetic nor the parasympathetic divisions ever stops working completely. For example, during a time of rest, the parasympathetic division is primarily active. However, even then, the sympathetic division constantly stimulates the blood vessels, keeping them partially constricted so as to maintain blood pressure. If the sympathetic stimulation were to stop, blood pressure would drop drastically and the person would go into shock. The sympathetic division. The sympathetic division is also called the thoracolumbar division because it arises from the thoracic and lumbar ranges of the spinal cord. The sympathetic preganglionic neurons begin within the spinal cord. From the cell bodies, myelinated fibers reach to sympathetic ganglia, most of which exist in chains along both sides of the spinal cord, even though the illustration here depicts the ganglia only along one side. Because the ganglia lie close to the spinal cord, the preganglionic neurons are short. Not all preganglionic neurons synapse in the first ganglion they encounter. Some travel up or down the chain to synapse with other ganglia at different levels. Others pass through the first ganglion to synapse with another ganglion a short distance away. Unmyelinated postganglionic fibers leave the ganglia and extend to the target organ. Postganglionic fibers tend to be long. The body at work. Rather than synapsing with a single postganglionic neuron, each preganglionic neuron of the sympathetic division branches and synapses with multiple postganglionic neurons. This arrangement allows one preganglionic neuron to excite multiple postganglionic neurons simultaneously. That's why the sympathetic division can ignite such an immediate, widespread response, such as what occurs during fight or flight. The adrenal glands. The adrenal glands, triangular-shaped glands perched on the tops of each kidney, play a role in the function of the sympathetic nervous system. The sympathetic preganglionic fibers pass through the outer cortex of the adrenal gland and terminate in the center, which is called the adrenal medulla. When stimulated, the adrenal medulla secretes the hormone epinephrine, along with small amounts of norepinephrine, into the bloodstream. Epinephrine, as well as norepinephrine, can bind to the receptors of sympathetic effectors, which helps prolong the sympathetic response. Page 195, the parasympathetic division. The neurons of the parasympathetic division arise from the brain and the sacral region of the spinal cord, which is why this division of the ANS is also called the craniosacral division.
The parasympathetic division has a calming effect on body functions. The neurons of the parasympathetic division arise from the brain and the sacral region of the spinal cord, which is why this division of the autonomic nervous system is also called the craniosacral division. Parasympathetic fibers leave the brainstem by joining the oculomotor, facial, glossopharyngeal, or vagus nerves. A few fibers also arise from the sacral region of the spinal cord. The oculomotor nerve, cranial nerve 3, carries parasympathetic fibers to the ciliary muscle, which thickens the lens of the eye, and to the pupillary constrictor, which constricts the pupil. Parasympathetic fibers carried in the facial nerve, or cranial nerve 7, regulate the tear glands, salivary glands, and nasal glands. Parasympathetic fibers carried in the glossopharyngeal nerve, or cranial nerve 9, trigger salivation. The vagus nerve, or cranial nerve 10, carries about 90% of all parasympathetic preganglionic fibers. It travels from the brain to organs in the thoracic cavity, including the lungs, esophagus, and heart, and the abdominal cavity, such as the liver, stomach, spleen, pancreas, kidneys, and intestines. Fibers from the sacral region travel by way of pelvic nerves to portions of the colon and the bladder. The ganglia of the parasympathetic division reside in or near the target organ. As a result, the preganglionic fibers of the parasympathetic division are long, whereas the postganglionic fibers are short. Because the ganglia are more widely dispersed, the parasympathetic division produces a more localized response than that of the sympathetic division.
Comparison of sympathetic and parasympathetic divisions. The sympathetic originates in thoracolumbar region. Ganglia lie in chain alongside the spinal cord, has short preganglionic and long postganglionic fiber, employs mostly norepinephrine as a neurotransmitter, occasionally uses acetylcholine, and produces widespread generalized effects. The parasympathetic originates in the craniosacral region. Ganglia lie in or near the target organs, has long preganglionic and short postganglionic fiber, employs acetylcholine as a neurotransmitter, and produces local effects. Question: which of the following is an action of the parasympathetic division of the autonomic nervous system? Does it A, increase heart rate, B, constrict bronchial tubes, C, stimulate sweat glands, or D, inhibit intestinal motility? The answer is B, it constricts bronchial tubes. The sympathetic division increases heart rate, stimulates sweat glands, and inhibits intestinal motility. Page 196. Effects of the ANS on target organs. The two divisions of the ANS tend to exert opposite effects. For example, the sympathetic division increases heart rate while the parasympathetic division slows it down. However, that's not always the case. For example, the sympathetic division triggers dilation of blood vessels leading to skeletal muscles, but it also constricts blood vessels leading to most organs. Two factors determine the effect of each division: the neurotransmitter released and the type of receptor on the target cells. Neurotransmitters. The ANS employs two different neurotransmitters, acetylcholine, ACH, and norepinephrine, NE. Fibers that secrete acetylcholine are called cholinergic fibers. Fibers that secrete norepinephrine, sometimes called not adrenaline, are called adrenergic fibers. Cholinergic fibers include preganglionic fibers of both the sympathetic and parasympathetic divisions, include the postganglionic fibers of the parasympathetic division, secretes acetylcholine. Adrenergic fibers include most, but not all, of the postganglionic fibers of the sympathetic division and secrete norepinephrine. The body at work. The effects of the parasympathetic division tend to be short-lived, while the effects of the sympathetic division last much longer. The difference in length of these responses is linked to the speed with which neurotransmitter is broken down after its release. For example, once ACH is released into the synaptic cleft, it's quickly broken down by the enzyme acetylcholinesterase, ACHE. As a result, the parasympathetic division exerts only short-term effects. In contrast, norepinephrine, the transmitter released only by postganglionic sympathetic fibers may be disposed of by one of three methods, none of which are as rapid as the breakdown of ACH. Some norepinephrine is reabsorbed by the nerve fiber, where it is either reused or broken down by the enzyme monoamine oxidase, MAO. Some of it is also absorbed by the surrounding tissue, where it is broken down by another enzyme. In addition, some of the norepinephrine may be absorbed by the bloodstream and carried throughout the body, further prolonging the effects of the sympathetic division. That makes sense. Remember, in all pathways, preganglionic fibers are cholinergic and secrete acetylcholine. Most sympathetic postganglionic fibers are adrenergic. See the diagram at the end of the chapter for a clear example of this complex process. Fast fact: recent research has shown that neurotransmitters other than norepinephrine and acetylcholine can bind to autonomic receptors, thus opening the door for the development of new medications. Receptors, page 197. After being released, the neurotransmitters bind to receptors on effector cells of the target organs. In brief, ACH, or acetylcholine, binds to the cholinergic receptors, and norepinephrine binds to the adrenergic receptors. However, within these two categories are receptors of several subtypes of receptors. It's these different types of receptors that determine the effect produced by a neurotransmitter. To illustrate the importance of the type of receptor, consider the fact that the sympathetic division secretes norepinephrine to constrict blood vessels of the skin and also to dilate the blood vessels of skeletal muscles. Likewise, the parasympathetic division secretes ACH to contract the bladder wall and also to relax the internal urethral sphincter. These opposite effects occur then not because of the neurotransmitters, but because of the receptor. Cholinergic receptors. Acetylcholine may bind to one of two different types of receptors. Nicotinic receptors. These receptors occur within the ganglia of the ANS, in the adrenal medulla, and in the neuromuscular junction. All cells with nicotinic receptors are excited by ACH. Muscarinic receptors. These receptors occur on the glands, smooth muscle, and cardiac muscle cells of the organs innervated by cholinergic fibers. Cells with muscarinic receptors exhibit a variable response to ACH. Some are excited while others are inhibited. This variable response occurs because of several subtypes of muscarinic receptors that exist. This variable response allows ACH to stimulate intestinal smooth muscle while inhibiting cardiac muscle. Adrenergic receptors. There are also two basic types of adrenergic receptors: alpha adrenergic receptors and beta adrenergic receptors. The following principles are true most of the time. Cells with alpha adrenergic receptors are excited by norepinephrine, and cells with beta adrenergic receptors are inhibited by norepinephrine. To illustrate the binding of norepinephrine to alpha adrenergic receptors in blood vessels causes the blood vessels to constrict. Arteries that supply blood to the heart and skeletal muscles contain beta adrenergic receptors. The binding of norepinephrine to these receptors causes the vessels to dilate. Be aware, however, that both alpha and beta receptors contain subtypes, alpha 1, alpha 2, beta 1, beta 2, which can cause exceptions to these principles. Fast fact: a group of drugs called beta blockers bind to beta receptors, effectively blocking norepinephrine and epinephrine from binding to those same receptors. Remember that the sympathetic nervous system stimulates the adrenal medulla to secrete epinephrine, a hormone that prolongs the sympathetic response. Blocking these hormones effectively lessens the sympathetic response, making the drugs useful for treating such disorders as high blood pressure and irregular heartbeats.
After being released, neurotransmitters bind to receptors on effector cells of target organs. Specifically, acetylcholine binds to cholinergic receptors, and norepinephrine binds to adrenergic receptors. Within these two categories of receptors are several subtypes of receptors. It is the type of receptor that determines the effect produced by a neurotransmitter. Preganglionic neurons in both the sympathetic and parasympathetic divisions of the autonomic nervous system secrete acetylcholine. Once released, acetylcholine may bind to either nicotinic receptors or muscarinic receptors. Cells with nicotinic receptors are excited by acetylcholine. Cells with muscarinic receptors exhibit a variable response to acetylcholine. Some are excited, whereas others are inhibited. After being secreted, acetylcholine binds to nicotinic receptors on the postganglionic neuron. This excites the next neuron. The postganglionic fibers in the parasympathetic division are also cholinergic, which means that these fibers also secrete acetylcholine. The acetylcholine secreted by postganglionic fibers of the parasympathetic division binds to muscarinic receptors on the target cell. Some cells with muscarinic receptors are excited by acetylcholine, others are inhibited by it. In the sympathetic division, a few of the postganglionic neurons are cholinergic, meaning that they too secrete acetylcholine. The acetylcholine binds to muscarinic receptors on the target cell, where it exerts a variable response. However, most postganglionic neurons of the sympathetic division are adrenergic, meaning that they secrete norepinephrine. Norepinephrine may bind with one of two types of receptors: alpha adrenergic receptors or beta adrenergic receptors. Most cells with alpha adrenergic receptors are excited by norepinephrine. Most cells with beta adrenergic receptors are inhibited by norepinephrine. These different receptors explain the sometimes contradictory effects of the sympathetic and parasympathetic divisions of the autonomic nervous system.
Page 198, neurotransmitters and receptors. The following diagrams summarize the different neurotransmitters and receptors of the two divisions of the autonomic nervous system. The sympathetic division: cholinergic fibers of preganglionic neurons secrete ACH. The ACH binds to nicotinic receptors on postganglionic neurons, which occasionally postganglionic neurons are cholinergic and secrete ACH, and then the ACH binds to the muscarinic receptors. Most postganglionic neurons are adrenergic and secrete norepinephrine. The norepinephrine binds to alpha and beta adrenergic receptors. Parasympathetic division: cholinergic fibers of preganglionic neurons secrete acetylcholine, ACH. ACH binds to nicotinic receptors on postganglionic neurons. Cholinergic postganglionic neurons secrete acetylcholine, ACH. The ACH binds to the muscarinic receptors. Question: the effect produced by a neurotransmitter is ultimately determined by A, the amount of neurotransmitter released, B, the type of neurotransmitter released, C, the type of receptor, or D, the number of receptors? The answer is C, the type of receptors. And the rationale is that the amount of neurotransmitter influences the strength of the response, not the type. Although the effect varies according to the type of neurotransmitter, the same neurotransmitter bound to a different receptor will have a different response. Therefore, it is the receptor that ultimately determines the response, and the number of receptors influences the strength of the response. Page 199, the body at work. Most organs receive nerve fibers from both the sympathetic and parasympathetic divisions. This is called dual innervation. Typically, the effects of the two divisions oppose one another. For example, the sympathetic division increases heart rate while the parasympathetic division slows it down. Also, the sympathetic division dilates pupils while the parasympathetic division constricts them. Sometimes, though, the effects of the two divisions complement each other to produce a desired effect. For example, parasympathetic division stimulates salivary glands to produce a thin secretion containing enzymes, while the sympathetic division stimulates the production of thick mucus. Both of these substances are needed to make saliva. Fast fact. Sympathetic fibers cause both blood vessel constriction and dilation. They do this by altering their frequency of firing. An increase in firing causes blood vessels to constrict. A decrease in firing results in dilation. This allows the sympathetic division to regulate blood pressure and blood flow without any help from parasympathetic fibers. Life lesson: medications and the nervous system. A number of drugs work by enhancing or inhibiting the effects of neurotransmitters. Following are some of the major classifications of these types of drugs. The sympathomimetics. These drugs enhance sympathetic action by either promoting the release of epinephrine or stimulating adrenergic receptors. A common example is phenylephrine, a drug found in many cold remedies. This drug stimulates alpha-1 receptors, which dilates the bronchial tubes to ease breathing and constricts blood vessels in the nose to ease nasal congestion. Sympatholytics. These drugs block the effects of epinephrine and norepinephrine primarily by inhibiting adrenergic receptors. This class of drug is often used to treat high blood pressure. Blocking alpha adrenergic receptors causes blood vessels to dilate and blood pressure to fall. Parasympathomimetics. These drugs, called cholinergics, stimulate or mimic the parasympathetic division. They do this by either stimulating the nicotinic or muscarinic receptors or by inhibiting acetylcholinesterase, the enzyme that breaks down ACH. One such drug is physostigmine, which is used to treat glaucoma, increased pressure in the eye, and delayed gastric emptying. Parasympatholytics, also called anticholinergics, these drugs inhibit ACH or acetylcholine release or block its receptors to reduce the activity of the parasympathetic division. Because one of the effects is to dilate the bronchial tubes in the lungs, This class of drug may be used to treat asthma. Life lesson: changes with aging. The type and degree of age-related changes in the brain and nervous system varies from one individual to the next. Some experience significant nerve degeneration while others have few changes. In general, most people experience slight slowing of thought and memory as the speed of nerve conduction slows. Other possible changes include reduced reflexes or sensation, leading to problems with safety. Dementia and severe memory loss are not a normal part of aging. When they occur, they often signal underlying disease. Illnesses not related to the brain, however, can cause changes in thinking and behavior. For example, an infection or unregulated blood glucose levels can cause severe confusion. Some evidence suggests that both physical and mental exercise, such as reading, doing crossword puzzles, and engaging in stimulating conversation, can help keep thinking sharp.